Another beautiful Saturday morning. Glad to have you with us here on Health Call Live. 38 degrees now, headed to a high today of 67. So we hope you're able to get out and enjoy the day. We are beginning our program with a focus on a problem that's kind of unique to women. And I didn't know that they could be managed with the care of a physical therapist. Now, I'm pretty dialed into healthcare issues, but really I didn't understand just exactly how therapists can play a role in helping women overcome incontinence, pain related to pregnancy, and some other issues that we're going to be talking about today. And so I think we're both going to learn something today as we talk to two women who have earned doctorates in physical therapy. Ashley Rager is with Steppin Up Physical Therapy. Good morning, Ashley.
Hi, good morning.
And Tayler Schortgen is here with us, both from Steppin Up Physical Therapy. Tayler, good morning.
Good morning, Lee.
Is it common for physical therapists to be trained in the care of incontinence? That seems like something that might be a little unusual.
Sure. So within the physical therapy education, pelvic rehabilitation is always discussed in the curriculum, but it's a pretty basic understanding of the pelvic floor and all that it can do. So you get that education through PT school, but then beyond school, grad school, there are a lot of training that goes beyond that to get more specialized in pelvic floor health and women's health.
And then do you offer this service at all the locations?
No, so we Ashley and I are at our southwest location just off of West Jefferson. So that is where we offer women's health.
We're going to be talking today about incontinence and then, as I said, pelvic pain, some other things. We'll get to that. Incontinence is a bigger problem in women than I think some people might realize. 46% of women are going to have incontinence at some point in their lives. I've read that women can spend as much as $750 a year on products related, hygiene pads, that kind of thing related to incontinence. And that from a health standpoint, it can be the cause of rashes, urinary tract infections, and other things. So it's not just inconvenient. There's also social embarrassment and depression, isolation that can come. So this is really an issue that needs to be dealt with. So I'm glad we're talking about it today.
Absolutely.
Happens in a couple different areas. There's two basic brands, I guess you could say, of incontinence. Urge incontinence and stress incontinence. Tell me a little bit about urge incontinence, Tayler.
So when you look at incontinence, the two main terms are urge and stress. So urge incontinence is usually incontinence that is preceded by this quick, I've got to go, it's time. You get up and you try to rush to the bathroom, but there's leaking or dripping that occurs. It can have triggers too. So things like when you get home and you put your key in the door, it's like, okay, I'm really close to the toilet. I'm home. It's my comfort zone.
Yeah.
You know, you get that strong urge that you have to urinate, and then involuntarily you have leakage or dripping that occurs with that strong urge to go.
We'll talk about some strategies for dealing with urge incontinence in a little bit. And then stress incontinence actually is the other form. Tell me more about that.
Yeah, so stress incontinence is when you have any kind of leaking with physical exertion. So that could be with laughing, coughing, sneezing are typically the three biggest triggers that I hear women talk about. And that can be because of just a weak pelvic floor and that increase in intra-abdominal pressure that is exerted onto that pelvic floor musculature.
We're going to talk a lot about that, about the pelvic floor, and as it applies predominantly with stress, I understand. So this happens very commonly as women age. The older you are, the more likely you are to experience this involuntary release of urine. Can you help me no matter where I am in that spectrum?
Certainly. So no matter how long this concern has been going on or what type, whether it's urge or stress or sometimes a combination of the two, there's no length of time where it can't be treated. If you've been going through it for a month or a few years or many years, there's something that pelvic rehabilitation can do for you.
Oh, that sounds encouraging. So is it easier if I'm younger, if I'm a new mom and I'm just struggling with this challenge initially as opposed to whether I've lived with it for years?
I think there can certainly be some of those things that can make it more difficult to get that full relief from, because you think of the time that you've been dealing with either weak pelvic floor muscles, or on the opposite side, overactive pelvic floor muscles where they're very tense, it's going to take a bit more time to really nail down behavior modifications. We're creatures of habit, right? So to break those habits that we've created over time can certainly take a bit longer if you've been going through them for longer.
So let's talk more about these pelvic floor muscles. And one of the things that I've learned about physical therapists is that you know a tremendous amount about anatomy. So kind of give us a little schooling here. We're talking about essentially this bundle of muscles that all work together to support what's in your abdomen.
Absolutely.
So tell me what happens. How do they get weak or tight, or what's going on there?
Yeah, so the pelvic floor muscles are basically like a bowl of muscles within the pelvic floor. If we looked at the pelvic model and we looked straight down, you'd see those pelvic floor muscles. They're the same type of muscles that we have throughout the rest of our body. They're skeletal muscle. We have voluntary control over those. Oftentimes they're just not trained properly because they're out of sight, out of mind. We can't actually see them. So most women and men don't even know that they're there. So those muscles, like I said, can get weak. They can be weak for two reasons. They can either be lengthened and be weak, or they can be tight and weak, because a tight muscle is also a weak muscle. And that could just happen over the years of not training those muscles from different kinds of trauma. So having a child, okay, and having the related scar tissue from that pregnancy and birth can cause those muscles to be tight also.
And we're talking about a group of, I think, 5 muscles. Isn't that correct? That all work together and support. I've read that they are your pelvic floor muscles are, think of them as the floor of the core.
Yes.
What does that mean?
Right. So when we look at the floor of the core, so I want to back up to the stabilizers of our trunk and our back and everything too. So the pelvic floor is actually one of 3 main stabilizers of our back and of our core. So they work together with a muscle in the abdomen called the transversus abdominis, called the corset muscle sometimes. So it works together with that muscle and the multifidi muscle in our back to help support our internal organs, to help keep things running smoothly. And it's always working to help support everything in our abdominal viscera. So it has to work together to help stabilize our back and help with postural control. There are many things that we don't think about the pelvic floor and its important role in doing those things.
So how do I strengthen the pelvic floor muscles?
Yeah, so there's some different kinds of strengthening. A lot of women, you've probably heard the word Kegel before. When women are dealing with any of these issues, a lot of times that's their first go-to. Got to do my Kegels. Now, sometimes Kegels aren't necessarily the answer for you. It certainly is the answer for some women. But like I said, sometimes those muscles are too tight, and we have to, first of all, down-train those muscles, which means you should be able to voluntarily contract and relax those muscles. Just like you can flex your arm and you can extend your arm, same exact thing. So Kegels is definitely one of the options, but sometimes we have to downtrain those muscles to make them actually stronger.
Yeah, and when you go to urinate also, it's actually a relaxation of those pelvic floor muscles. So when we are not consciously using the restroom, they're actually contracted, and they're helping support and keep the urine in the bladder. So then we have to make sure that we're educating properly on it's actually a relaxation of those muscles to then create proper urination.
So give me an idea of what kind of exercises you're going to teach me to do at Steppin Up Physical Therapy.
Sure. So if we're looking for more relaxation training, say the pelvic floor is too tense, if there's too much exertion from that, we'll always start with breathing exercises and starting with becoming aware of where the pelvic floor exists, where you can sense that pelvic floor so that you become more aware. Once you're more aware of where it's at, then the success of treatment's going to really grow from that. So we'll start with breathing exercises and relaxation training. Diaphragmatic breathing is one of the ones that we'll do. We'll work on core stability and lumbar stability since they all work together, and make sure that you really gain a good sense of where the pelvic floor is at and how you can make it work for you.
So how do you evaluate whether I'm too tight or too loose?
Yeah, there's some different strategies. Most of our evaluation actually just revolves around talking to our patient. I just let my patient talk, and often the clues are found in their story. If a person is having incontinence, but also it can be paired with some other things, oftentimes they'll have trouble actually emptying their bladder completely. They'll also have pelvic pain, pain during intercourse. Those are all clues to me that their pelvic floor is actually overactive rather than underactive.
Okay. So if I'm tight, now you're going to teach me to relax. Obviously, if it's too lax, now I have to tighten. So what are some things I'm going to do there if not a Kegel?
If not a Kegel. So what we'll do if there's too much tension within the pelvic floor, we can actually do internal releases too of the pelvic floor musculature, where we will release some of those muscles if there are trigger points within the pelvic floor, because oftentimes those can contribute to some of the things that Ashley just mentioned, pain during intercourse, pelvic pain in general, back pain even, sacroiliac joint pain, and sometimes even referred pain down the legs can actually be traced back to tension or trigger points within the pelvic floor musculature. So we can actually release those with an internal examination of the pelvic floor.
And then if those muscles are too loose, like they're not strong enough and they're not tight, we've actually found that researchers have found that activating the adductors, which are the muscles in the inside of our thighs, and then the hip muscles on the outside of our thighs can actually facilitate the contraction of the pelvic floor muscles. So if a woman is not able to really just get the hang of what a Kegel is, how to contract their pelvic floor, we'll often add in exercises surrounding those different muscles to help facilitate that, and they often have a much better outcome.
Interesting. So you're addressing the pelvic floor muscles in the hips and other areas.
Yep.
Sure.
Yep.
Curious. So pelvic pain is something that is not uncommon. And let's talk a little anatomy here. So in your pelvis, there are the two large sort of wings that you feel as your hips. That's the iliac crest.
Correct.
And then in the back at the sacrum, there is a joint back there. So you've got actually the tail of your spine comes down, and then the two iliac crests form on the outside of that, and those are all joined together by ligaments.
Yes.
So there's your anatomy lesson for the morning. So with all of that in place, what's hurting? What's causing the pain?
Sure.
Right. So oftentimes, if you're having pelvic pain, it can actually be like trigger points or knots within those muscles. So just like any other muscle, you can get knots in those. So oftentimes, like up in our shoulders, you can feel that. These muscles are skeletal muscle. They can get trigger points or knots in them too. And we actually hold in stress, tension, and anxiety in with the same muscles we hold in gas, stool, and urine. So oftentimes, women are just carrying all of this stress and tension within their pelvic floors and not even aware of it until it's, manifesting as pain. So it can absolutely be contributing from the SI joint also, or the sacroiliac joint. But oftentimes we find that it is trigger points within these very pelvic floor muscles.
So a trigger point is, you described it as a knot. So are you feeling my body? Are you touching me to figure out what's tight? How does that work?
Correct. Yes. So it will be done from both the outside, so looking at hip muscles, looking at glute muscles. There can be areas where trigger points are located within those muscles as well, but also inside the pelvic floor where it would be an internal examination of the pelvic floor, where we would feel those muscles and sense trigger points throughout that, sometimes by actually feeling them with our hands, also sometimes from the patient saying, yes, that's recreating my pain. I'm feeling what I'm sensing when I'm having pain. It's a good sign that we found the location where there's restriction or tightness.
And then what do you do? Is it a physical manipulation of that spot? Are you rubbing it out, in other words?
Yeah, so we can either do like a dynamic release, okay, where you're just kind of ironing out those muscles and actually like physically bringing those muscles down into more of a relaxation. But it can also be like a static release, just like when we're massaging the external muscles. Okay, we apply pressure there, hold that pressure. I typically have my patient just go into some deep diaphragmatic breathing. And over that time, as that muscle is receiving more oxygen, we're pushing out that stagnant blood flow, that muscle actually releases, or that knot will release. And they will tell you that they feel less discomfort with the same amount of pressure that's being applied.
Oh, okay. We have about 2 minutes left. So tell me, in that time remaining, what do you think women need to know and want to understand? What can we give people at home that they can try themselves, or something that is DIY?
Sure. So one thing that we want to start with is that although pelvic pain and incontinence is common, so a lot of women and men have incontinence and they talk about that, and it seems like it's just a common thing that happens. It's not normal. It's not something that you should be having, and that there is hope and there's help, and we would love to help out in that situation, to restore that confidence in yourself and what your body is able to do.
I love that. Common is not normal.
Correct.
Yeah, that's a good way to go.
Yeah.
And the isolation that sometimes comes up because of incontinence is just unfortunate for so many people.
Absolutely.
So walk me through. I'm going to come to your place, and in about a minute or so, tell me my process to get started and help you understand and help me solve my problem.
Sure. So you come into our clinic. We're going to give you a packet of paperwork to fill out. That's very thorough, helps us to understand exactly what's going on with your pelvic floor. We will do a one-on-one consultation with you. The very first visit's always a consultation. There's typically no very much hands-on work that very first time, and we just want to listen to your story. And then from there, we'll develop a plan of care and teach you a lot about anatomy that you've never known before, and create a plan of care and work together to help with your symptoms.
Yeah.
Thank you very much. That's Steppin Up Physical Therapy's Ashley Rager and Tayler Schortgen from the Southwest location of Steppin Up Physical Therapy. They have 4 locations in Fort Wayne, but the specialty in women's care is only at the Southwest location. You can visit steppinupt.com to find the location nearest to you, and you can even use the chat feature on their website if you like, if you have a quick question. Again, you don't need a physician's referral for any of the services offered at Steppin Up Physical Therapy. Simply call and schedule your initial evaluation, and you can find the number again at steppinupt.com.